For joining us. We're going to convene our joint hearing with the Public Safety and Military Affairs Committee and our good friends from the Health and Human Services Committee on this January 24th at 3 o'clock in room 225. This meeting is being streamed live on YouTube. In the unlikely event we have some kind of technical difficulties, we will call for the reconvening of the remaining part of our agenda and reconvene on Friday, the 26th of January at 3 o'clock in this same room. And just to lay out the ground rules, we're going to have testifiers limited to 2 minutes to say whatever their opposition or support is for the various measures. With that said, we're going to jump into our first bill, which is Senate Bill 2005. First to testify is Tommy Johnson from the Department of Corrections.
Thank you. Good afternoon, Chairs Wakai, Chair San Buenaventura, Vice Chair Elefante, Vice Chair Aquino, and members of both committees. I'll summarize my one-page testimony. In short, we already have a CIP request in, so we support the intent of this measure, but we have a $45 million CIP request in the governor's budget for this. We received $5 million last year. We're asking for release of that money. Previously, we had already started planning and design of a consolidated healthcare unit at OCCC that would, at Halava, that would have 41 beds, 12 suicide beds, suicide watch beds, and 29 general medical and mental health beds. So we'd ask the legislature to support our CIP request so we can get this done. I'd also like to mention that as part of the planning and design for the new OCCC, that will have a consolidated healthcare unit as well, considerably larger than this, the 41 beds. Thank you.
Thank you, Director. We have testimony from the Department of Health. Anyone here from the Department of Health? Members, you have the testimony in your packet. Fred Hun from the Paroling Authority.
Corey Rickey, acting administrator, standing in for Chairman Goulet, who's our all filing. We stand by our written testimony when we're available if you have any questions.
Thank you. Tricia Chong from NAMI Hawaii has submitted testimony support. Alan Johnson from the Hawaii Substance Abuse Coalition has submitted commentary. Carrie Shirota from ACLU is here.
Aloha Chairs, Vice Chairs, Committee members, Carrie Shirota, Policy Director for the ACLU of Hawaii. We strongly oppose this measure for a number of reasons. We'd like to start off with a quote from our current Department of Public Safety, now Corrections Director, who said last year at our Breaking Symposiums conference, jail for those with mental health illness is the most costly and least effective option. This is something that we can agree with our director. It is not a best practice to put people, many of whom can be better served in our community. Jail is expensive. We spend over $250 a day, over $90,000 a year. We need to shift our priorities, put money into the community to get the people the help that they need, and that we stop this cycle of recidivism, which is currently at 58%. So if we want to continue wasting taxpayer dollars and ignore seminal literature that talks about incarceration exacerbating the mental health condition of so many people who are going into our jails and prisons, and for people who don't have mental health conditions, there's doctors from the World Health Organization that state that if they don't come in with a mental health condition, they may likely leave with that. And then they come into our community. So we need to reinvest in what works, and that's community-based treatment. And when we absolutely need people to get the medical treatment that they need, it can be in other types of facilities. You can call it a mental health facility, you can call it a jail, you can call it whatever you want, but it's the same principle. We keep putting money into things that are not working. And I just want to highlight really quickly that a number of states that have invested in evidence-based practices have reduced their carceral system. New York, California by 40,000 people, New York by over 20,000, New Jersey by 8,000. Let's learn from our youth correctional system. We can reduce the population and get the people the help that they need through care, not building more cages by any other name. Thank you.
Thank you, Ms. Shirota. David Fukuzawa has submitted testimony in support. Michael Older, also in support. Cards Pinor is in support. Robert Merce is in opposition. Raylan Yeomans is in opposition and I believe is joining us via Zoom. Is that correct, IT? Okay, well, maybe if she comes on later, we will invite her back, but she has members submitted testimony in opposition. Don Viviani, also in opposition. Wendy Viviani, also in opposition. Kalani Warner from UPW.
UPW side of the great testimony opposition.
Thank you, Khan. Keldon Watjen from the Prosecuting Attorney's Office has submitted testimony in support. Heather Lusk from the Hawaii Health and Harm Reduction Center has submitted testimony in opposition. Is there anyone else wishing to testify on Senate Bill 2005? Yes, Kat.
Aloha. Aloha, Chair Wakai and Chair San Buenaventura. I'm Kat Brady from Community Alliance on Prisons. I first want to apologize because I sent the population report instead of my testimony. But hey, that was interesting information for you anyway. So, but I did send my testimony to everybody on both committees last night. We oppose this bill because prisons, jails, they're not places for people who are struggling with mental health issues. We have a lot of people in our facilities who act out, who, you know, go through these episodes, and we have a staff that's not really trained to deal with them. So this is really concerning to us, and we believe mental health should be done in a medical-like facility. It is not healthy to be in a jail. They are prey when they're in jail. And that is a problem. We're setting up problems when we put mentally ill people in jail. So I'm saying, yes, if you broke the law, there are ways that we can deal with that. But first, let's deal with that mental health, or we'll never get past that. So this is really a bill about compassion. It's about people. It's not about buildings. It's about people who are suffering every day. And what are we going to do? Put them in cages? That does not work. We already have proof. There are many, many alternatives. And we're asking that you follow the research, you follow best practices, and you stop building cages for people who have many, many problems. Thank you.
Thank you, Kat. Is there anyone else wishing to testify on Senate Bill 2005? Hi, Angela. Happy Halloween.
Happy New Year. Aloha, Public Safety Committee and Health Committee, Angela Melody Young, testifying on behalf of CARES, and just wishing to comment. So while I agree building more institutional facilities such as jails is not a good thing, but if there are going to be jails and prisons, we cannot fight reality, right? We have jails and prisons. And so I think the way I'm interpreting this bill is that it's saying we should provide medical care for those who are suffering from mental health conditions because they are already in jail, right? So mental health facilities for the incarcerated is good for them when they are in prison if they are suffering from psychiatric symptoms such as panic attacks, which can sometimes cause arrhythmia, psychotic episodes. They need help. This bill is very considerate to include symptoms and diagnosed conditions. So symptoms of a sickness in mental health could be that they're experiencing hallucinations. They have slow intrusive thoughts creeping up in the back of their minds. They imagine people and things that don't exist. They hear voices. They experience episodes of manic activity, extreme mood, behavior, activity, and energy level, and actual diagnosed conditions such as schizophrenia. And they're debilitated with a sickness of their mental health. So psychiatric care can consist of behavioral management, supporting the return to their regular life activities and treatment for comorbid psychiatric disorders using standard evidence-based psychopharmacological and psychotherapeutic modalities, along with appropriate educational and family interventions. So CARES testifies in support because we need to support the prisoners and their mental health. And actually, I'm more for Senate Bill 2094 to let prisoners adopt pets, which in few jurisdictions is already effective. For example, the pilot program from California.
Thank you.
Thank you.
Angela. Is there anyone else wishing to testify on Senate Bill 2005? Members, questions?
Yes,
Chair?
okay, Director Johnson. Thank you. So it looks like the halal, according to your testimony, the $45 million in the budget is for Halava,
Is to build a consolidated healthcare unit there, yes.
in Halava.
Yes, at the Halava facility.
So these are like what the last testifier said. These are people who are already sentenced.
Correct.
Do you have any plans or projected plans for OCCC having
Well-
something similar?
Yes. In fact, when we build the new OCCC, it will have a larger mental health medical unit because the population is larger and it's more transient. However, that doesn't prevent us in the meantime, when we build this unit, to transfer those that are needed at level of care temporarily to OCCC, to Halava, so they can receive that care.
Okay, here's the problem though.
Mhm.
My understanding of OCCC is it also includes misdemeanors and those awaiting trial.
Correct.
So I don't know how you can transfer those who are awaiting trial and not sentenced from OCCC to Halava.
You override the classification because they need that level of treatment that we can't provide there. Our thing is we would have to keep them separate from sentenced felons when we do transfer them if we have to.
Okay, so I'm sorry.
Sure.
I'm going to need to ask an attorney a question. Is there somebody from Public Defender here? Judiciary? I know there's somebody from ACLU, but I don't know if they know the criminal justice system. Okay, so since you're here, I got to ask you the question. So we just had a judiciary WAM briefing to this morning. And yesterday we had a health WAM briefing. And what happened in the health WAM briefing was we found out, well, one, Kaneohe State Hospital is overcrowded. And we know because of a death of an employee there that we do not have ACOs at Hawai'i State Hospital because it's a treatment facility. It's not an incarceration facility, even though it's supposed to be a secured setting. So what we found out today was that when those who are pre-incarceration awaiting trial are are detained because they are unable to post bail or are otherwise have a mental illness but are otherwise awaiting trial are in Kaneohe State Hospital. About a third of them, 1/3, okay, which would substantially increase our bed space if we're able to remove them from there, would be eligible to be clinically discharged. However, judiciary says that once they are in Hawai'i State Hospital for treatment, they are under the custody of Department of Health and cannot transfer them to OCCC. But that's not your understanding. You're telling me.
No. What I was saying was, we, as a Department of Correction and Rehabilitation, if we wanted to transfer an inmate from one of our facilities to another one of our facilities, we have the ability to do that.
Okay.
But once someone is ordered to go to Department of Health and they're a patient of Department of Health
They
in the
cannot
state hospital,
transfer back.
they can't transfer back unless there's a court order to say the person is now fit to stand trial and they can now come back and be a pre-sentenced or detained individual while they await trial.
Yeah.
Right.
See, what I've heard from Kaneohe State Hospital is even though they are fit to stand trial because of the backlog in judiciary, they're still stuck in Hawai'i State Hospital and using up bed space. But okay, I gotta do a fix for that. But
Okay.
so second question.
Sure.
If this bill doesn't pass, do you still have the ability to have this treatment facility in Halava?
Yes, because of the, as long as our, that's why I asked in the
So long as
testimony,
the budget.
as long as our CIP request in the governor's executive budget is supported by the legislature. And if we build it in one phase instead of two phases, it'll be cheaper because we don't have to deal with escalation costs. We estimated about 30 months from breaking ground to when we finish if we do it all in one phase. If we do it in two phases, it'll cost more than the 45 million. And we're looking at 48 months plus.
So shouldn't we keep this bill alive in case you do not get what you want in your budget?
Yes, I'm not asking to kill the bill. I just provided comments and clarity on that. We have a request in, and we'd ask you to support that while this vehicle moves forward too. That's fine.
Okay, good, because that's what we heard from the WAM briefings in the Department of Health when I asked them about this bill, as well as a judiciary briefing earlier, that everyone seems to be supportive of having a treatment facility in a secured setting.
And we should. That is correct.
Okay, thank you very much.
Thank you.
Members, any further questions?
Chair.
Oh,
Yeah.
Chair.
A couple for Director Johnson. The first is currently now, couldn't we use existing facilities under DCR's control to house these certain inmates that are underutilized?
We have two facilities underutilized. That is the Waiaba Correctional Facility minimum has no fencing, and the Kalani Correctional Facility on the Big Island. However, when you look at housing folks, when you look at the classification level, and unfortunately, some of the folks with mental health issues may not qualify to be in an area where there's no fencing.
But has the department looked at using existing facility to maybe house this particular population at those underutilized facilities?
No, we have not, because they're not secure facilities.
Understood. And then secondly is, shouldn't this be more of a DOH state hospital issue rather than under DCR?
It would only be their issue if the courts ordered them to the state hospital. You have to understand, we have a lot of people in our custody and care that have mental health issues that don't rise to the level of the treatment of the disease level of the mental illness required to be at the state hospital. So they're in this gap. And so for those that are in prison, we do need to provide appropriate level of services. But I do agree that those that have acute, severe mental health illness that we don't have the expertise for, they should be in another setting.
Okay. Thank you, Director. Thank you, Chair.
Members, any further questions?
I have one more, sorry. Is somebody here from Department of Health?
No.
No, I didn't think so. Never mind.
I have a question, short question. I want to follow up on Senator Elefante's questioning there. It seems a little bit backwards, right? This bill presumes that someone gets into the criminal justice system and then they get mental health services. Whereas from a societal benefit standpoint, shouldn't it be where we take care of your mental illness before we get into your prison system? So if we're going to go down the route of spending $45 million on a mental health facility, shouldn't it be with the Department of Health so that they ultimately keep the person from being in your custody?
Well, I think what we're asking for is for consolidated medical unit to address not just those already in our custody with mental health issues, but those in our custody who are suicidal and those in our custody who need medical care. We just don't have the bed space at the Halava Infirmary now for the population we have. Our population is older and they have more issues. And so I would agree that a secure mental health facility for that level of treatment should belong to the Department of Health. But we're not talking about that. We're talking about those guys that are in that gray area that don't meet the qualification to go to the Department of Health, but clearly need medication and treatment, and they're in our custody and care, and we can't just let them go.
Okay. Any further questions?
And
Senator Rose?
yeah, here I go.
Mr. Warren, you mind coming up? Thanks. So your testimony indicates that you're opposed to the bill partly because of the public-private partnership aspect of it, but also because you think there should be other priorities, which I don't really disagree with, but it does, there is a distinction here between pretrial detainees, of course, and people who've already been convicted of a crime. And I think it's fair to say that there's a pretty high percentage of people who have been convicted of a crime have mental illnesses, and they're probably not going to get out for a while because they've already been convicted of a crime. I don't know, maybe there's too many ifs, ands, and buts in there, but if it wasn't a P3 and it was targeted at people who have already been convicted, would that change your thinking on it, or would you still have objections?
I think the P3 is what concerns us the most,
P3
actually.
is what's really bothers you. Okay.
That's what it is. Partially also because of the understaffing situation and how
Yeah.
this facility would be staffed. I don't think we'd necessarily disagree with what the director said. It's just, there's a lot of ifs and a lot of unknowns. I think based on the conversation that I've had over the last couple of days, I think there needs to be greater coordination between the departments about how to move this forward. And really, it's just, should the committee decide to move this forward, we just hope that our concerns will be taken into consideration. But to your point, our biggest concern is the privatization part.
Okay. Do you know what other states do? And I'm sorry, this is a different tangent. Do the prison systems run the medical facilities, or do they have like the Department of Health come in and run them?
I'd have to defer actually to the director on that.
Okay. All right. Thank you. Thanks, Chair. If you know the answer, Director, I'd be interested, because it seems to me like it is sort of a mismatch of tasks.
Well, first I'd like to clarify, if the bill would allow the state to go into private partnership, that is to build only, to design and build. The facility would be run and staffed by Department of Corrections Rehabilitation staff, not by any private entity. The only private entity that would come in is if we contracted for services for the mental health services to come into the facility. What was the other question you had, Senator? I'm sorry.
I'm curious what other states do, whether the prison hospitals or the prison medical facilities, are those run by whatever the equivalent of the Department of Corrections is, or do they bring in another agency or somebody else to do it?
No, they're generally run by the state, because the state is the medical provider for the people in its
The
custody and
Department of
care.
Corrections does it,
Yes.
not the Department of Health.
Correct.
Okay, thanks. Thanks, Chair. Chair.
No, I believe Senator Rhodes would have asked my question.
Yeah, thank you, Chair. Thank you, Director. There were some statistics in terms of the proportion of the population that might fall within the range needing care in a facility like this. It's being proposed. I'm wondering if you have numbers. One of the testifiers noted and I don't know if the terminology is appropriate, but to your point, noted that the target population are individuals with significant mental health issues, as opposed to the definition term severe, which usually qualifies them for the judiciary process that might ultimately place them in the state hospital.
Mhm.
So if we're going to use the term significant mental illness to define what you were mentioning earlier, the folks who clearly have mental health issues but don't rise to the level of state hospital care, how many people are we talking about?
I'm not sure, but I can tell you that about 30% or more of the folks that come to our doors, whether jail or prison, have some serious mental health issues. We have contracted with ACA to look at our assessment protocols to see if we're missing anyone. But I can tell you this, Carrie Anchiota is right in that the jail setting is the most expensive, least effective option. So what the state should have in place is some type of intercept model. It's my understanding that the governor's office with Dr. Michael Champion is working on that now, where at every step there's some kind of intercept and maybe a diversion from the criminal justice system. The first would be the contact with the police department in the field. The second would be at first arraignment. The third would be if they do come to us, we have the ability to divert them into other programs. It is much, much cheaper and more effective for people with mental health illnesses for their issue to be addressed in the community. My position is, if they do end up in our custody, despite our best efforts, the criminal justice system best efforts up front, then we need to have the appropriate level of care to provide that care that they need and the services they need.
Does the facility that is contemplated in your CIP request cover the potential 30% of the population that you believe need care?
It's nowhere near that, and it's at one location. So we're talking about a 30% or more across our entire population of about 3,700 convicted felons, pre-sentence and sentenced misdemeanors. I should also indicate that the AMHD, a lot of our clients are known, the folks that come to us are known to AMHD because they've been receiving services in the community. But they get off their medications, they do some type of crime, petty misdemeanor crime, they end up in the criminal justice system. They go to court, the court continues the hearing, see you in 2 weeks. Well, I can tell you that somebody who's off their medication and living on the street is not going to remember they have a court hearing in 3 weeks. So they get contempt of court. A warrant gets issued, they come to our custody. Now we have somebody who's off their medication for a substantial period of time, have other needs, and now we have to try to deal with them. I can't tell you how many times we have people coming in our custody who have mental health issues, who also have some real physical issues, and we have to take them to the emergency room, and the cost is astronomical. We've paid up to $200,000 in medical care for single inmates before, and some of them are detainees, but we don't have a choice. We have to take everyone that comes to our custody and care. So yeah, we need a robust diversion system up front. But if they do come to us, we need to have the ability to meet their needs for sure.
So you're saying, okay, so you're not arguing against what you said earlier, I guess. I would mention that the cost to treat a patient at the Hawaii State Hospital is roughly $365,000 a year, 4 times the amount of an individual incarcerated.
I would imagine that's why. Well, the level of care is what drives the cost. But if you look at the criteria to get to the state hospital, you're really dealing with the people who have really serious mental health issues that are persistent and are really life changing. Yeah.
That's a separate issue. So I shouldn't have brought it up, except I wanted to. I'm sure you understood that if we're going to talk about the price, there's a significant difference. Thank you, Chair.
Any further questions? Senator Elefante?
One more follow-up for the representative from UPW. So in your testimony on your last bullet point, it says that UPW supports a replacement facility for OCCC rather than a new mental health facility. So if I read that correctly, would UPW be supportive of the CIP request that Director Johnson mentioned for sort of a new healthcare facility within that new OCCC?
Yes.
Okay. Thank you. Thank you, Chair.
Sure. Members, any final questions? If not, thank you. We're going to move on to the next bill, that being Senate Bill 2013. First on our testifiers list is Director Johnson. Yeah, it's your lucky day.
Good afternoon again, Chairs Wakai, Chair Santa Buenaventura. I always got to take my time with that one. Vice Chair Aquino and Vice Chair Elefante and members of the committee. As you know, I'm Tommy Johnson, the Director of the DCR. So for this bill relating to healthcare fees, I'll summarize it because we provided voluminous testimony. So in short, if this measure passes and inmates are allowed to allowed to demand elective care, it's going to drive up the cost. And I'll give you an example in my testimony here. We had an inmate ask who believed the department should pay for his hair laser removal. Luckily, it was a statute that had to do with insurance carriers and not with us. But that's the type of request we're going to get. And if we're forced to do that, our costs are going to go up astronomically. So we'd have to come in and ask for millions and millions of dollars. We provide the same level of care that a person would get in the community. But I think what you have to remember is that someone who is convicted of a crime, who's in prison, we are the primary healthcare provider. We have the doctors, physicians assigned to them. We have healthcare professionals assigned to them. And while it may seem at times restrictive, if the person needs care, specialty care, we send them out to see a specialist. If we can provide the level of care in the facilities, we provide that. I indicated earlier, we have spent up to $200,000 or more on a single inmate, and that's routine sometimes when we have inmates who have serious illnesses and issues. So I would ask that we oppose this measure, because if you really look at what it does, it creates a Club Med where you come and get whatever you want, a la carte. You come in, you demand this, we got to give it to you. But ask yourself this: would the person, is that a quality of life issue? Would the person really need that? And would they do it on their own dime as opposed to the state paying for it, had they have a choice?
Perfect. Thank you, Director. John Ikinaga from the Public Defender's Office. has submitted testimony in support. Carrie Shiroto, ACLU.
Aloha Chairs, we support this measure. We just want to point out there are a number of states that have enacted this. And really, we need to look at the bigger picture, right? At first glance, some people will say, well, they're incarcerated, they did the crime, they should pay for it. But who really pays for it? Oftentimes, it can be family members as well, who are the most impoverished in our community, that may be adding, they have to use money for commissary stamps, phone calls, keeping in touch with families. Beyond that, it actually, the out-of-reach co-pays makes it dangerous to other people who are inside the facility, as well as those who work there and their families. If you look at how much people who are in jail or prison, if they have a job at all, which is a small percentage, they're making 25 cents an hour. 25 cents. If a copay to get access to treatment is $3, that person may not spend that $3 because they need to save that to call their child, to send a letter to their family. And if it's some kind of communicable disease, then that can spread. So when you look at some of the literature in this area, it says that there are unintended consequences when you have these copays. When sick people avoid seeking care, it can more likely spread in the facility into the community. And when people are released back into the community, second illnesses are likely to worsen if people avoid the doctor, which can lead to those emergency calls, right, to our hospitals that the director mentioned that can come up to over $200,000. A few of the states that have now removed this copay, Massachusetts, Montana, Nebraska, New Mexico, New York, Oregon, Vermont, Wyoming, California, Illinois, and a few of these just did this most recently. And I just want to point out that regardless of whether we want it or not, the U.S. Supreme Court in Estelle versus Gamble decision stated that it is the department's responsibility to care for the health of people in our jails and prisons. And I think we need to look at who's in our jails and prisons. I'm not sorry, this is not much bigger. This blue line shows that the majority of people in our jails and prisons, high disproportionate rate, are Native Hawaiians. And the fact that this happens year after year, decade after decade, is just absolutely shameful. Let's get people, let's focus on diversion, getting the help that they need. And if they need the treatment inside, let not the copay be a barrier. Thank you so much, Senators.
Barbara Polk has submitted testimony in support. Is there anyone else wishing to testify on 2013? Yes, Kat.
I did send my testimony in support of this measure because I think healthcare for everybody is important. Everybody who's incarcerated is going to come back to the community, and that will impact the community healthcare system. So please, let's think about our people and do everything we can to help them be as healthy as possible. Thank you.
Thank you. Is there anyone else wishing to testify on 2013? Not members, any questions?
Yeah. Director Johnson. Of course. So,
Before you
thank
ask
you,
a question, I'd
Director.
like to clarify one thing in my testimony. I should have mentioned this, that we suspended the copay over 2 years ago. So no one has been paying a copay. Go ahead, I'm sorry.
So that's basically some of my questions was one, whether or not those who are incarcerated who do not have MedQuest, do you help them apply for MedQuest?
We help them apply for MedQuest as they're going out the door.
But what about when they come in?
I'll have to double check. I'm not sure, to be perfectly frank.
Okay, I think there's somebody here that,
This is our healthcare administrator.
yes.
Hi, Romy Glidewell, nurse practitioner and new healthcare division administrator. My understanding is that Healthcare MedQuest ceases coverage of incarcerated detainees from the second that they're sentenced. And that's where our coverage technically is the state coverage that is applied to them.
So are you saying that they are ineligible for MedQuest?
As a ward of the state, correct. It's one of our challenges because we do send quite a few of our inmates out into community, and we pay the Medicaid fee separately because they are disconnected from their MedQuest insurance. And it's difficult to find community partners who will continue to take our patients on that fee scale.
Okay. Yes, because then my follow-up would have been, how do we collect from Medicaid then? But if they don't qualify, I'll talk to Julie Moore Peterson. Thank you.
Members, any further questions? Just two follow-up questions. So Mr. Shirota from ACLU says that, you know, even a $3 copay is hard for them to pay for, but you're saying that there is no copay, so whatever treatments they get it free of charge.
Correct. And in particular, even before that, those with chronic illnesses and diseases, we never charge them a copay.
Okay, and then you cover all of the procedures that are medically needed. The elective stuff like hair removal, tanning, or whatever somebody wants, that is not covered by you. And
that is
would,
correct.
if someone were to ask for that and had the financial wherewithal, they would pay for that, right?
They would pay for provide, but they'd have to, my understanding is we would allow them to pay for it, but they'd also have to pay for the ACO escorts cost to take them to the procedure.
Thank you.
Sorry, just follow up. Could you come back in?
Yeah.
So you folks help them apply for Medicaid when they leave. What about for work furlough?
Work furlough, as far as like Fernhurst and some of the placements, they're working
Yes.
in community. If they have private insurance from their workers or from MedQuest, they can get it. And they can actually still obtain their own private insurance while incarcerated. It's just specifically the Quest plans.
So if they are sentenced to probation with a period of incarceration, you're saying they are not eligible for MedQuest? And that's why you folks are not applying? Because I'm trying to see whether or not we could get some monies, some federal monies to help pay for the treatment facilities that looks like we're gonna end up having to put in their budget later on.
Well, you actually bring up a good point that I'd have to look into as far as like Medicare. And one of the things that we had talked about earlier with the previous bill is that we do have an aging population and they should actually qualify for Medicare separate from Medicaid. So that's something that I haven't actually looked into, but anybody who's 65 or older, and again, we do have an aging population, and that is a large part of our budget is as they do have Alzheimer's and dementia and that higher level of care. We could look into that, but I'm not sure if that qualifies. But Medicaid, they don't qualify for.
I'm sorry, one other question. Before you folks suspended the co-pays, how did you collect?
It was taken from the inmate account.
Okay, and that's the reason why they're here.
Yeah.
It's because then they won't have much money at all when they barely could make money. Okay, so will you look into that if there is ability?
Yeah.
Because
happy.
if we are gonna have these treatment facilities, we're gonna need to pay for them, right? Thank you.
You're welcome.
Members, any further questions? If not, we'll take a brief recess prior to taking the vote. Thank you for your patience. We're reconvening the Committee on Public Safety, Intergovernmental and Military Affairs, and our friends from the Health and Human Services Committee. The two chairs have conferred on the two bills in front of us today on Senate Bill 2005 relating to mental health. We understand that there is a budget request for public safety, Department of Corrections and Rehabilitation, but would like to just pass this bill on as kind of a backstop and also indication to our friends of the Ways and Means Committee. This is a really important issue to address, to provide the proper mental health facilities for our kabaina that are suffering with some type of issues there. So I'd like to pass this measure out as is. Members, any discussion? If not, Senator Elefante, I vote yes.
Chair's recommendation is to pass SB 2005 as is. Chair votes aye. Vice Chair votes aye with reservation. Senator Fukunaga.
Reservations.
With reservation. Senator Rhodes.
Reservation.
With reservation. Senator Awa.
No.
Mr. Chair is passed as is.
Thank you.
Okay, so for Health, Human Services, Chair's recommendation is the same, is to pass it as is. Vice Chair for the vote. Chair votes aye.
Okay, Chair votes aye, Vice Chair votes aye. Senator Keokalole.
Aye.
Senator Shimabukuro.
Reservations.
Senator Alwa.
No.
Recommendation is adopted, Chair.
Thank you. The next measure, Senate Bill 2013, relating to healthcare fees of detainees and committed persons. It sounds like the Department of Corrections and Rehabilitation already covers any kind of health issues that need to be addressed. I don't know if we want to use taxpayers' monies to cover kind of non-life-threatening or life-extending or issues that regarding someone's health, if it's just cosmetic or otherwise. I don't think we should be using taxpayers' monies to cover those things. So the chairs have conferred and are going to defer this measure in front of us. Okay, thank you. We
Thank
are
you.
adjourned for this committee.
Thank you.
Thank you for sticking around. It is shortly after 3:01 on this January 24th for the Committee on Public Safety and Intergovernmental and Military Affairs. We have a number of items on this agenda. The first one is Senate Bill 2091 relating to public utilities. First on our testifiers list is Don Chang from DLNR. In support. Okay, thank you, Rob. Michael Angelo from DCCA.
Good afternoon, chairs, vice chair, and members of the committee. My name is Mike Angelo. I'm executive director of Corporate Commerce and Consumer Affairs and Consumer Advocacy. We stand on our written testimony, comments.
Thank you, Michael. Leo Asuncion, PUC.
Aloha Chair, committee members, please Kyra Howe, utility analyst at PUC. I stand on the committee's written testimony. Questions.
Thank you, Kyra. Jimmy Alberts from Hawaiian Electric. Welcome.
Aloha, Chair Wakai, Vice Chair Elefante, and committee members. I'm here today to testify on behalf of Hawaiian Electric to provide comments and recommended amendments. So you've seen those in our testimony. Now, Hawaiian Electric does understand the importance of a comprehensive risk-based wildfire mitigation plan. And that's the essence of why we're making the recommendations for amendments. So the amendments, as you read through them, I want to make sure we point out that we're not waiting for these bills as a company. Hawaiian Electric is actively pursuing its own wildfire mitigation plan. And I'll give you some examples of those things real quickly. So we've changed settings on our transmission system, our distribution system to prevent ignitions. We're inspecting poles or replacing poles. We're doing all the things to harden our infrastructure and make things safer. But we do believe that adding to this bill, while we're in support of the bill, we do believe adding to it to make it a more comprehensive bill, like Senate Bill 3096, the way it defines the comprehensive nature of a wildfire mitigation plan would add value and benefit to the overall process. Now, the amendments we've suggested don't remove anything from this bill. We've only added to it as recommendations for your consideration to make it more robust. And if we end up in a place with a regulated, approved plan by the Public Utilities Commission, that's a great outcome from a stakeholder perspective across the board because it is designed and then it will provide the most cost-effective and efficient way possible to keep our people and our communities safe. So we appreciate the committee's consideration of these amendments to Senate Bill 2091. We thank you for the opportunity to testify.
Thank you, Mr. Alberts. Is there anyone else wishing to testify on Senate Bill 2091? Yes, Kika.
Thank you, Chair, Vice Chair, members. My name is Kika Bukowski on behalf of IBW 1260. IBW 1260 represents the labor from electric utilities throughout the state. And we totally appreciate and understand and support the intent of the bill. We understand the gravity of what is the impetus of the bill. Many of our members were present prior to, during and remain there to try to assist in any way we can to bring some sense of normalcy to Maui. And we want to just say, I apologize, first of all, for not submitting written testimony, but we wanted to verbally support the intent of the bill and respectfully request consideration for the amendments as proposed by Hawaiian Electric.
Would you
Thank you.
mind sending us some written
Yes.
commentary afterwards?
Yes, thank you.
Is there anyone else wishing to testify on Senate Bill 2091? If not, members, any questions? Oh, he's not. Okay, Jim, Mr. Alberts, sorry. I looked at all of your amendments and they seem reasonable. I do have questions about the last part of your suggested amendments, which is to protect HECO from any kind of civil liability based on whatever steps are taken in the better management of the grid. Why is that necessary? Because if we take liability away from you, it just doesn't disappear, it goes someplace else.
Yeah, so I think I'll give you my opinion. So the essence of that was really to create a standards for this wildfire mitigation plan and then hold us accountable to those standards. So that's the purpose.
But I mean, if someone wanted to sue you, they're going to sue you anyway, even if we put this language in there.
Yep, I think they could. But I think the way this is evolving, even in other states, these kinds of attributes that create the standards and the plan, and then hold people accountable to that plan, then they've done their duty to fulfill that obligation.
Members, any further questions? Thank you, Mr. Alberts. We're going to move on to Senate Bill 2092 relating to public utilities. On our testifiers list, Michelangelo from DCCA.
Chair, Vice Chairs, as member of the CCA, advocacy, executive director, stand on a written testimony by council.
Thank you. Leo Sunshin, Akira.
Good afternoon, Chair, Vice Chair, and committee members. My name is Kyra Howe, utility analyst at the Public Utilities Commission, and I stand on a testimony.
Thank you, Kyra. Jim Alberts.
Hello again, Chair Wakai, Vice Chair Elefante, and committee members. Thank you for allowing us to testify here today. I just wanted to say briefly that we agree with the intent of this bill to incentivize these actions, but we would recommend a more holistic view and the approach on how this is done. And I think the best way to describe that is to give some examples. So if you think about a risk-based model, and that's really what we are aspiring to achieve, is if you look at all the risks and you invest your available funds into those risks with the highest return and benefit, then that's the way it should be done. So again, with this process, rather than specifically calling out what those things should be, maybe a risk-based approach that would identify that could fit into the wildfire mitigation plan to help make these decisions. Because we are working on things like applications for federal grants, and you may have seen that in the news that we've received an award. We're currently negotiating that, but that can help offset some of the costs that better our system and make it safer for people rather than having to invest as much money at their home. So I think while both are necessary, we do support this, but we think that a broader approach would be more effective. Thank you.
Thank you, Mr. Alberts. Julie Yunker from Hawai'i Gas.
Hi, good afternoon. Julie Yunker, Hawai'i Gas, Director of Sustainability, Government Community Relations. Thank you for the opportunity to offer comments. Hawai'i Gas appreciates the intent of this measure to reduce the devastation and impact of wildfires to utility customers. We appreciate that this bill is to provide benefits to the residents of wildfire-prone areas, and that we understand it was fashioned after legislation in California after the PG&E wildfires. I would just like to offer a few comments. First, that wildfires are an above-ground event impacting infrastructure that is generally above ground. Our S&G utility is regulated by the PUC, and our S&G is provided for utility customers primarily through our 1,100 miles of underground infrastructure. By nature of our underground infrastructure, it is not prone to above-ground disasters such as wildfires, winds, and hurricanes. Additionally, we monitor our infrastructure 24/7, and we have the ability to shut off our gas in an emergency situation with isolation shutoff valves at strategic locations. I would also like to note that in the history of Hawaii Gas since 1904, we've maintained a safe and reliable network where we only had to intentionally shut down our pipeline as an intentional measure during Pearl Harbor. We also understand the bill's intent is to reduce or eliminate impacts on properties and to provide emergency equipment and de-energized events. De-energization is a term frequently used when referring to electricity and above-ground infrastructure. De-energization events do not pertain to use as Hawaii Gas infrastructure is underground, providing a buffer to interruptions caused by weather events, including wildfires. Additionally, our infrastructure has inherent and intentional characteristics supporting its ability to provide consistent service, including severe weather events. So if the grid is impacted by any de-energized events, we are able to provide gas services to our customers. Thank you for the opportunity to share our comments.
Thank you, Julie.
Thanks.
Victor Ramos has submitted testimony in opposition. Is there anyone else wishing to testify on Senate Bill 2092? Mr. Curtis?
Aloha, Chair Wakai, Vice Chairs, and members of the committee. I'm Henry Curtis, Executive Director of Life of the Land. We see two problems with this bill. First, it talks about fire-prone areas. DLNR has identified 55 high-risk areas, but fire-prone seems to be anywhere that a fire could erupt, and it's not defined in the bill. But more seriously, it seems to indicate that a rich person living in a mixed, living in an area that could erupt in a fire, that they cut back on the vegetation around their house to improve the value of their house, then should be subsidized by renters and low-income people who are paying rates at the through to the utility. So it seems to be a bill that allows reverse Robin Hood economics. Thank you.
Thank you, Mr. Curtis. Any other testifiers on this measure? Members, questions? I have a quick question for PUC. Kyra, sorry. Ms. Yunker was correct that this bill was fashioned after the Paradise Fires, where PG&E has above ground pipes. Do you agree with their Hawaii Gas's commentary that they should be removed because they're probably not going to be the cause or prone to fires because everything is underground for them?
My understanding is gas infrastructure is less vulnerable than electric infrastructure. However, I don't think I have enough information to provide you a better answer than that. So I'm happy to follow up.
Well, if we move this bill on, you'll have an opportunity to follow up. Thank you. Members, any further questions? If not, thank you, Kyra. We're going to move on to Senate Bill 2228 relating to fire protection. On our testifiers list, we have Don Chang or Rob from DLNR. Thank you, Rob. Kazul Todd, State Fire Council, has submitted testimony support. Bradford Ventura from the State Fire Council, also in support. Sheldon Howe from the Hawaii Fire Department is in support. And is there anyone else wishing to testify on Senate Bill 2228? Well, members, any questions of, all we have is Rob? No? Okay, we're gonna move on. Before we move on, Mr. Curtis, sorry, when we have just verbal testimony, if you could somehow put that in writing and give it to my clerk, and anyone else who might not have provided us written testimony but want to articulate your commentary, if you could reduce that to writing and give it to our clerk, that would be very helpful so we can get that on the record. Thank you. We're going to go on to our next measure, that is Senate Bill 2229. And this one is relating to public safety. On our testifiers list, we have Kazuo Todd from the State Fire Council has submitted testimony in support. Bradford Ventura from the State Fire Council as well, support. Alice Lee from the Maui County Council has provided testimony in support. Evan Oe from NAIOP Hawaii chapter.
Hi, good afternoon, Chair, Vice Chair. But on behalf of Hawaii, Sarah, testimony.
Thank you, Evan. Dean Uchida from BIA has submitted testimony in opposition. Max Lindsay from BIA also in Yep, sorry, that was my fault. Hi, Dean, joining us via Zoom.
Hi, thank you, Senator. We stand our testimony in opposition. I think the testimony indicates the legislature has a challenge to balance the housing affordability issue with this increased cost that installing or mandating fire sprinklers in residential units would contain. So we stand in our testimony in opposition.
Thank you. Thank you for joining us, Dean. Max Lindsay, also from BIA, has submitted testimony in opposition. Sheldon Howe from the Honolulu Fire Department is in support. And Victor Ramos has submitted testimony in opposition. Is there anyone else wishing to testify on Senate Bill 2229?
Yes, Chair. Gary Lum from the State Fire Council. Hello?
Yep. Yes. Sorry. Welcome.
Thank you. We've submitted written testimony on behalf of the State Fire Council and just wanted to comment, based on recent events, there are varying levels of fire risk in different communities throughout Hawaii. Section 4619.8 prohibits the use of an essential tool the counties may need to address and mitigate fire risk in a particular community. Therefore, the State Fire Council urges the community support to repeal Section 4619.8 to allow individual counties to consider installation of automatic fire sprinkler systems in new 1 and 2 family residential structures if needed. Thank you.
Thank you, Mr. Lum. Is there anyone else wishing to testify on 2229? If not, members, any questions? Senator Fukunaga?
I think my question would be to the State Fire Council. You know, we recently had an instance of high-rise residential condominium fire, which resulted in adoption of mandatory sprinkler legislation to retrofit older buildings, you know, to install fire buildings safer. And I think one of the issues that we have run into is that retrofitting older buildings to.
Yeah. Okay, short recess. Sorry for the technical disruption. Members, we are back to Senate Bill 2229 relating to public safety, and the floor is given to Senator Fukunaga.
Okay, I guess the question for the State Fire Council would be, to what extent is your organization, you know, reaching out to, I guess, NIOP and others to come up with ways to make the requirement manageable, both for property owners and unit owners?
Okay, first of all, this bill is related to new installation, not retrofit. And this is for 1 and 2 family dwellings, not high-rise condominiums. So the cost is much lower than what what you were talking about earlier. Second, there's a couple of bills offering or proposing tax credits or tax rebates related to installation of fire sprinkler systems that are presented to the legislature this session. So hopefully that'll help address some of those issues that you're concerned about.
Okay, well, we're sort of familiar with some of the challenges associated with the high-rise sprinkler requirement, and seeing how difficult it is to come up with solutions for that specific issue, I can appreciate why the industry and the Fire Council have not been able to find common ground on the installation of fire safety equipment in new construction, because the rebates and all the other things, tax credits that we have been looking at have been insufficient to really make much of a dent in the actual cost of installation that would have to be borne by all the members of a specific building. So, after seeing how difficult that was, I really think Fire Council should get together with the industry. Thank you.
Thank you, Senator Fukunaga. Any further questions? If not, we're going to move on to the next bill. That is Senate Bill 2093 relating to fireworks. On our testifiers list, we have Michael Vincent from DLE.
Good afternoon, Chair Okai, Vice Chair Elefante, and members of the committee. Department of Law Enforcement stands in strong support of the bill. During the summer, the fall, we were working with the Department of the Attorney General trying to come up with an administration measure. It was like late Sunday night, they actually gave a go-ahead. So there's an administration bill, and I know the Attorney General has a number of concerns in their testimony, and those are the kinds of things we were working out. What we'd like to recommend is that the language of this bill be replaced with the language from the administration bill, which is Senate Bill 3148. That's 3148. Thank you very much.
Thank you, Mr. Vincent. Brenton Inoue from the AG's office.
Good afternoon, Brenton Inoue, Deputy Attorney General. We provide suggestions primarily to strengthen the Department of Law Enforcement's capacity to conduct warrantless administrative searches under the regulatory authority of the fire department. We also suggest that limiting the cost of recovery for storage and disposal fees to civil penalties rather than through criminal fines. And last, we suggest further defining unopened case or according to this chapter. We also provided written testimony, and I'm available to answer any questions that you might have. Thank you.
Thank you, Mr. Inoue. Kazuo Todd from the State Fire Council has submitted testimony in support and might be on Zoom. IT, is Mr. Todd on Zoom?
Fortunately, he's not here at the moment.
Okay, thank you. Bradford Ventura from the State Fire Council has submitted testimony in support. David Fukuzawa from an individual has submitted testimony in support. Sheldon Howe from the Honolulu Fire Department in support, and Victor Ramos in opposition. Is there anyone else wishing to testify on Senate Bill 2093? If not, members, any questions? Yes.
Law enforcement. Yeah, law enforcement.
Oh, Mr. Vincent.
Yes, sir.
Yeah, so I know you guys are in support of the bill, but going forward to do the task force and entering the premise, when we have this thing going forward, what would be the difference between law enforcement and HPD on this task force in entering the property? And what would give you guys, how you guys would have probable cause to enter the property if I have illegal fireworks, or I have a permit and I'm busting illegal fireworks, but you don't see it, there's no witnesses, nobody's telling you, but you're on call. How you guys going to enter the property to investigate and complete this, something like this task force that is going forward? I understand everybody's supporting it, I support it too, but how difficult is this to actually be accomplished?
Without getting into a lot of the details, one of the things that the task force, which is comprised of county law enforcement, state, federal partners, there are a number of indicators and things that they're able to see with respect to shipping permit holders, what they're claiming that they have that would, the kind of indicators that would give some red flags to look at. And these are permit holders, and we're not looking at going into individuals' homes or private residences. That's excluded in the administration bill. But it's more to, you've got a permit, very similar to some of the other businesses that get permits. They're subject to inspection. But it's not just a free pass to go willy-nilly looking where law enforcement wants. And it's under the auspices of the fire departments who are issuing the permits and the task force and the things that they're finding. So it's not, we're not going into people's homes. We're not doing things like that.
Thank you for the clarification. And then going forward, when they start issuing these permits for the fire department, they're going to have this written on the permits that they're issuing? Because right now they issue out permits, I can buy 5. Senator Wakai can buy 5, and so forth and so on, right? So you understand what I'm saying, right? Because if
Yes,
it's
sir.
not written, and then they're going to say, hey, you guys passed this, never said the law and passed, but say pass the law, but nobody really underlying told us about this going through.
Yes, sir. So part of the changes in the bill is exactly that. It's
Okay.
all the structure, and we're primarily looking at larger purchases.
Yeah.
I don't know how to say that without saying too much. So, I mean, I live in ground zero for, when it comes to fireworks, right in the middle of Kalihi. So,
I thought you was going to say White Powell, excuse me.
no,
sorry.
no. But I just know the task force has been doing a lot of good work.
Yes.
And just under 150,000 pounds so far, and
Right on.
so,
Thank you, Chair. Yes,
Thank
thank
you.
you for the clarification.
thank you, sir. Yes,
Mr.
sir.
Vincent, I have a quick question. If I recall, this language for 2093 came from DLE.
Yes, it did.
Yeah, and then I hear you saying in your testimony that you rather have SB 3148.
Yes.
So why did you give me this bill and why did you tell me to hear it?
Because we were trying to get it in, and we didn't know whether we were going to get one in the administration measure. It wasn't until late Sunday when we said, okay, it's going to be in, and the state was the next day. And when I was getting this in, I didn't have the bill number yet. Otherwise, we would have just done it.
Okay, so you want to see this bill go away and you want to see us have a hearing on 3148.
Yes, sir.
Okay, got it. Thank you. Members, any further questions? If not, we're going to move on to Senate Bill 2003 relating to law enforcement. Mr. Vincent, you're up.
Criminal law enforcement standards testimony.
Tricia Nakamatsu from the Prosecuting Attorney's Office. Stephanie's on the last bill. We're not on the last bill. Okay, sorry. Donna Manzano from the Honolulu Police Department has submitted testimony commentary. Doug Chin, Police Commission, commentary. Tricia Chong from NAMI, Hawaii has submitted testimony in support. Josh Frost from ACLU, commentary. David Fukuzawa in support. Michael Older in support. Ellen Ching from the County of Kauai. Oh, is Don, sorry, did I miss? Who's this? Jen? Don
Manzano.
Oh, okay, sorry, Mr. Manzano. Didn't see you on Zoom. Please share with us your thoughts on this measure.
Good afternoon, Chair, Vice Chair, members of the committee. I'm Don Manzano, Acting Captain of the Training Division of the Honolulu Police Department, City and County of Honolulu. The HPD supports the intent of Senate Bill number 2003 relating to law enforcement requiring the establishment of training in cultural competency, implicit bias, and racial and ethnic sensitivity, as well as crisis intervention training. Currently, the HPD annually trains its officers on implicit bias and bias-based profiling, including racial and ethnic sensitivity. Since 2003, 2022, each graduating recruit class has received 8 hours of certified training in mental health first aid, which covers the proposed areas of instruction in the bill. The HPD has concerns regarding the language of the bill, setting specific hours for training. Training hours vary on the curriculum used, which includes those provided by the City and County of Honolulu and nationally recognized training. The HPD would recommend language be amended to state that the outline training be provided to officers rather than specific set amounts of training hours. HPD appreciates the committee's consideration of our comments and concerns regarding Senate Bill number 2003 relating to law enforcement, and thanks you for the opportunity to testify.
Well, thank you,
Be
Mr.
available for any questions.
Thank you. Back to our testifiers list, we had Victor Ramos, who submitted testimony in opposition. Is there anyone else wishing to testify on Senate Bill 2003? If not, Angela, this is really important because we got 2 more bills. Okay, thank you for summarizing. We're on 2003.
The last one? Oh.
Not, we're gonna get to the last one. Anyone else on 2003? Members, any questions?
Is she needing to testify?
Yeah, I was gonna get to that.
Okay.
Sorry, I see, Stephanie, I see you on Zoom. And sorry, I assume that you were interested in the last bill, but were you interested in Senate Bill 2093? Stephanie?
Yes, sorry, Senator. We didn't get our written testimony in time on that bill, but since I was at the hearing, I did ask the IT staff if I could comment. And I apologize for doing that late. I don't want to testify out of order and disrupt the committee proceedings, but we're strongly in support of the intent of that bill.
Okay, but as we heard from Mr. Vincent, we're going to defer this bill and use another bill, 3148. So you might want to have another opportunity to testify on fireworks.
We'll be ready for that. Thank you, sir.
Okay, sure. Okay,
Sure.
I think, yes.
HPD, can I talk on HPD on this bill?
Don, are you still there? Mr. Manzano? IT, is Mr. Manzano still there? Oh,
Yes,
there he is.
Yeah.
Question for you.
Yeah, the question that I have is that you talked about having first aid mental training. I'm not sure. When I got first aid in construction, is just first aid, putting on Band-Aids. So what is the actual course of the first aid in mental training that these officers and these new recruits have because of the extent of the encounter? And don't get me wrong, it's not easy handling a mental person in the community, but I just wanted to elaborate on what is the extensive training that they're having so that we can and the community can understand on what you guys are trying to do better there at HPD.
Yes, so what we do is we try to evaluate and, de-escalate situations, all that kind of stuff, a variation of things we do dealing with mental people in crisis.
And then one more question, going with the cultural and other stuff in the bill, you're not supporting it, or you want less hours to implement it in law enforcement when it comes to our ethnicity and our background on dealing with different nationalities and going forward? You think that that's too much to be asking for the officers? And the reason why I'm asking you this, and I don't want this to escalate and thinking that you guys are all against other nationalities, but it's a proven fact. Historically, that's what's been happening. So that's the reason why I support the intent of the bill in going forward and seeing how we can better equip our law enforcement officers when they come to culturally and other stuff like that. So is any of that you guys are going to try to implement, or is just that this is not something that you would consider?
This is something the HPD supports, and we look to implement this.
So you guys are supporting that?
We are supporting that, and we already do some of that training already.
All right, can you just one quick one elaborate on what part that training comes in when you guys retraining recruits?
Yeah, annually. We do that annually when we recall our officers when they do the retraining.
So every, what, 3 months, every 6 months,
Every year,
every year?
yes.
Okay, thank you, Chair.
Okay, welcome. Any further questions, members? Okay, if not, we're going to move on to our last bill, Senate Bill 2094 relating to corrections, otherwise known as Who Let the Dogs Out Bill. Senate Bill 2094, Tommy Johnson on a testifiers list.
Like WWF.
Good afternoon, Chair Wakai, Vice Chair Alafante, and members of the committee. I'm Tommy Johnson, the Director of Correction Rehabilitation. I'll just summarize my one-page testimony. We are in strong support of this measure. We've already started meeting with the Humane Society. We had the first site visit last Friday at the Women's Community Correctional Facility. We will be able to eat the cost of getting this program up and running, but we will need $100,000 that's in the bill.
Thank you, Mr. Johnson. Stephanie Kendrick from the Humane Society. Welcome back, Stephanie.
Thank you, Chair Wakai, Vice Chair Elefante, committee members, Stephanie Kendrick from the Hawaiian Humane Society. We are in strong support of this bill. As Director Johnson mentioned, we've had preliminary meetings with him as well as with Warden, sorry, I'm being distracted, Galanta and her team. And I have to say, you know, the Department of Corrections and Rehabilitation, so impressed with their commitment to the women in their custody and to providing them with opportunities to, you know, learn new skills and approach the world after incarceration with a new lease on life. And if we can be part of that through supporting the human-animal bond and also saving animal lives in the process, we are just honored to be in support of the program and really grateful to Senator Wakai and to the department for their interest in this, their enthusiasm for it. On our site tour on Friday, it just became so clear that the team there really wants to do right by the people that they have in their care, and I'm excited to see this going. So thank you for hearing this bill. I hope you will support it and give it the funding that it needs. And we are looking forward to being good partners. Thank you.
Thank you, Ms. Kendrick. It's actually a new leash on life. Just joking. Okay, Josh Frost from ACLU has submitted testimony in support. Kalani Warner from UPW.
Thank you, Senator Thomas.
Thank you, Kamaka. Inga Gibson has submitted testimony in support. David Fukuzawa in support. Helen Jospenko in support. Michael Older in support. Aria Castillo in support. Brandy Shimabukuro in support. And Linda Rich in support. Is there anyone else wishing to testify on this measure? Angela? Angela, we have 5 minutes. So you could summarize, please.
Aloha, Angela Melody Young, testifying in strong support on behalf of CARES, a grassroots initiative. This is the kind of alternative program we'd like to support. Alternative programs to the traditional programs within institutional correctional facilities is very non-traditional. So diversion and alternatives to incarceration provide ways for individuals who have broken the law to be held accountable without disrupting their ability to lead productive lives and contribute to the community. Diversion and community-based treatment and nonprofits and churches creating this support for prisoners creates less of a burden for the state because the nonprofit and the community-based groups provides the resources without an appropriation of funds from the state, right? So the community-based groups providing the care also provides the resources. So this specific alternative program is already enacted in California. A pilot program which pairs rescue puppies with inmates started in California City Correctional Facility in January 2016, teaching inmates to become puppy trainers. And it's now been rolled out to a few prisons and a juvenile correction center. To date, the pilot program has had a bunch of graduates from the program and has saved 200 puppies from high kill shelters. Kill 2 birds with 1 stone is the same. With such a policy structure as this, it raises awareness about standard institutional prisons and how it's not good and it serves to help two problems of society: animal rescue and institutional corrections facilities, right? So a few jurisdictions already has had this policy enacted. Hawaii is actually behind this. And CARES represents a team of students. In our work, we like talking to the community leaders about non-traditional ideas, and it takes both the older generation and our generation now to create a brighter future. Thank you.
Thank you, Angela. Is there anyone else wishing to testify on this measure? Members, any questions? Yes, Senator Favela.
Thank you so much. Very quickly, corrections, it's only a simple question. Are you gonna do this at two of the facilities, the one in Never Beach and the one in town? For the Humane Society?
We don't have a facility in Never Beach. We have a facility in Wai'au.
No. For the, what, you guys gonna have this women's go to where?
No, it's gonna be at the Women's Community Correctional Center.
They're gonna bring them
in
over
Kailua.
there.
We
Okay.
did it, the Humane Society did a site inspection or a site visit, if you will.
Right.
We have some things to get ready, but it will be in the facility itself.
All right.
The veterinary services will be brought to the facility via some veterinary students, is my understanding. It's going to be a great program. I think it's going to teach the inmates empathy.
Okay. Thank you. Thank you, Chair. Appreciate
Any
you.
further questions? Director Johnson, just one quick question. I talked to the WAM staff and they said because this is a supplemental year, they can't fund this for 2 years. Is it safe to say that if we cut this down in half to 1 year, $50,000 is an appropriate figure to put in there?
Yeah, because we'll try with any existing funding we have. I think it's a worthwhile project. We got to at least try. If it's successful, we show proof of concept and we come in and ask for funding for other facilities as well, full funding.
Okay, great. Thank you. Members, any final questions on this last measure? If not, we'll take a brief recess prior to taking the vote. We're reconvening our Committee on Public Safety, Intergovernmental and Military Affairs on our 301 agenda for decision-making on Senate Bill 2091 relating to public utilities in our efforts to try to make sure that we're better prepared perhaps in the future for any potential fire, wildfire that might be touched off by a utility. We'd like to pass this measure out. We would like to take all of HECO's suggested amendments except for the last section that reduces and says that they are not liable, civilly liable for any after that. I don't think that's right to put in there. So we're going to take that part of the amendments out of the suggested amendments. Members, any discussion? If not, Senator Elefante, I vote yes.
Chair's recommendations to pass SB 2091 with amendments. Chair votes aye. Vice Chair votes aye. Senator Fukunaga.
Aye.
Senator Rhodes.
Aye.
Senator Awa.
Aye.
Recommendations adopted.
Thank you. On Senate Bill 2092 relating to public utilities, I heard from the gas company that they have everything underground and they really shouldn't be pulled into this measure. So we're going to take the gas utility out, so basically make it for the electric utilities. We're going to take all of the PUC suggested amendments in the measure. Those amendments are on page 1, lines 8 through 9, and those were the 2 suggested amendments. Members, any discussion? If not, Senator Elefante, I vote yes.
Chair's recommendations to pass SB 2092 with amendments of the 5 members present. Any no votes or votes with reservations? Hearing none, Mr. Chair, recommendations adopted.
Thank you. On Senate Bill 2228 relating to the fire protection, I think we all see the value of the State Fire Council, but have devoted absolutely no money to them. This is a mechanism in which they can take some tobacco, cigarette money and use it to fund our needed oversight over fires throughout the state. So Chair's suggestion is to pass this measure out as is. Members, any discussion? If not, Senator Elefante, I vote yes.
Chair's recommendations to pass SB 2228 as is of the members present. Any no votes or votes with reservations? Mr. Chair, recommendations adopted.
On Senate Bill 2229 relating to public safety, this is the fire sprinkler bill and giving the counties the opportunity to do as they please and might in fact require a mandate for fire sprinklers in single-family homes and other dwellings, and considering the costs. And, you know, we heard the other day from the state of the state about housing and how that's such an important nut to crack, putting an added burden and mandate that we're going to add to the cost of housing in the state. I don't think it's proper time to do that. So we'd like to defer any action on Senate Bill 2229. On the next measure, 2093 relating to fireworks. As we heard from DLE, they think that Senate Bill 3148 is a better vehicle. So we will hear that bill probably next week, members, and we'll defer action on 2093. The next measure is Senate Bill 2003 relating to law enforcement. We heard from law enforcement, police departments that they already do this. In fact, Department of Law Enforcement says that there are better bills out there to address this measure. So it's a recommendation to defer action on 2003. And Bow Wow, the last bill, 2094, SB 2094, relating to corrections. This would bring cats initially and in the future dogs as a means of therapy and making our unwanted animals more wanted and adoptable. So one thing I'd like to do those, because we cannot fund this for 2 years, since this is a supplemental year, we'd like to cut everything in half and make this a 1-year pilot project and reduce the cost down to $50,000. Members, any discussion?
So with amendments.
With amendments, yes. Any discussion? If not, Senator Elefante, I vote yes.
Chair's recommendation is to pass SB 2094 with amendments of the 5 members present. Any no votes or votes with reservations? Hearing none, Mr. Chair, your recommendation is adopted.
Meow. We're done. Thank you.